Do you dread bedtime? Are you exhausted? Trying to juggle your personal and work life with little to no sleep? I understand. I have been there. You are not alone. There are solutions. Hi, I'm Jessica, certified pediatric sleep consultant and owner of Jessica Levangie Sleep Consulting, and I'm here to tell you that there is a better way. My approach to helping your child sleep is simple. You know your baby best. We take your knowledge of your child, my knowledge of infant and toddler sleep, pair it with your parenting style, and build the perfect step-by-step sleep plan together. I believe that sleep deprivation is not something that parents and caregivers alike have to live with, and I am here to guide you through every step toward a better sleep. Let me help you. To learn more about my support packages, visit jessicalevangiesleep.com and follow me on social media for tips and tricks on Instagram at Jessica Levangie Sleep or Facebook at Jessica Levangie Sleep Consulting. Sleep has never been closer.
Welcome to the morning meeting with Sarah and Jess,
where the tea is hot, the wine is chilled, and no topic is off limits. Pull up a chair and join us. There is room for all of you here.
We won't limit seating, we'll just build a bigger table. Let's begin today's meeting.
Hey everybody, Sarah and Jess here. Welcome to today's morning meeting. Last week was such a good episode with Heather and Haley. We are so thankful and grateful that they opened their hearts to us to share their reciprocal IVF journey. This week, we are equally as excited as we have a very special guest with us.
This week, we sat down with Dr. GYNE McMullen.
And we talked a lot about our vaginas.
We sure did.
How could we not?
Dr. GYNE McMullen was born and raised in Cape Breton, Nova Scotia. After completing a bachelor's degree in biology at Acadia University, she moved to Halifax to complete her medical degree at Dalhousie University. A passion for women's health and reproductive rights led to a career in obstetrics and gynecology. After completing her residency in OB/GYN at the IWK in Halifax, Dr. McMullen fulfilled a long-standing dream of returning to Cape Breton and opened a practice in 2019. Her special professional interests include vulvar dermatology, family planning, and preconception counseling. When not working, Jillian is busy tending to her many fur babies or crafting. A woman of many talents. She loves discussing women's health and was so excited to join the morning meeting, but not as excited as Jess and I. We had Dr. McMullen on the top of our guest list when we sat down and thought about who we wanted to chat with and who we wanted to invite around the table. We knew we wanted to get her and pick her brain about what we needed to know and what you all need to know about women's health and taking care of your vajayjays in your 30s. So enjoy. Hi, Jessica.
Hi, Sarah.
How are you?
Good.
It's good. Hi, Jill.
Hi, guys.
Jill or Jillian? What do you prefer?
Either.
Okay. Well, Dr. GYNE McMullen is with us today. We're actually in her lovely home and are so glad to be here. Thank you for joining us on the morning meeting.
Thank you guys so much for having me. It's a real honor to be part of this. I've been listening to your podcast and it's fantastic. And I'm so excited to be part of it.
Yay! You're so sweet. She
That
listens.
makes me feel so special.
I know, me too.
That like important people.
Oh, God.
I'm basically like a major fangirl over Dr. McMullen.
I feel left
feels
out
good.
that she didn't deliver Logan.
And you should, to
I
be
wanna
honest.
redo.
Just a little jealous.
Yeah.
A little jealous.
Not redo, take two.
Take
Two.
Yeah.
True.
Yeah.
I don't know. See, I don't know if I'm there. I don't know.
Well, we're so glad to have you with us, and we are looking forward to this topic. And we're so happy to be here because we always knew that we wanted to create this space for women and this safe space for women to talk about things that sometimes we feel a little uncomfortable talking about. And there's so many things that we say, like, do other women feel this way too, or is it just us? But then you're too embarrassed or too scared or whatever it is to ask other women, sometimes even your best friends. And I think a lot of that is around women's health and gynecology and the whole piece of that. So we knew when we started that a topic we would want to talk about would be women and our bodies and women's health.
Vaginas.
And yeah, just and what an OB/GYN wants us to know. Like, what should we be focusing on and what should we know and how best to take care of ourselves. So like I said, we were so excited to get you on the pod, and we wrote that down like right away in our early days. Like, this is a topic we need to, because we need to pull a professional in for this, we think. So
Google just doesn't cut it.
No, Dr. Google, he did not do well at medical school.
yeah. Not good. Didn't pass. Yeah, didn't pass. And then he just sends you down the rabbit holes of big, hairy, scary stuff.
Yes. Absolutely. Funny you say big hairy, and we're talking about vaginas.
Pun intended.
Yeah.
So yes, we want to talk to you today just about your career, your experience in gynecology and obstetrics, what led you to that career, to a career in medicine, what made you pick that area, what led you back to Cape Breton, so many things. And then we'll pick your brain a little bit about what you think we should know. Women in our 30s, what's important?
Awesome. Sounds great.
Yay, let's jump into it.
Okay.
Do you want to tell us a little bit about yourself?
Yeah, sure. So I was born and raised in Sydney, which is in Cape Breton, Nova Scotia. I knew that I wanted to do medicine very early on. I think probably I was 16 when I sort of settled on it. But both of my parents are physicians, so I did have really strong role models.
Right.
At that time, I was really interested in neurosurgery because I was really interested in people living with spinal cord injuries. Wow. So I went and did my undergrad at Acadia with a honors in bio, and my research project was actually in neuroscience, my honors thesis. But when I actually got into medical school and actually started to see what real medicine was like, my attention turned more to the surgical specialties. So I went to Dal, and at Dalhousie, in your first and second year at that time, you would do electives where 1/2 a day, once a week, you would go with a staff in whatever specialty that you chose, and you would essentially shadow them. So in my first year, I decided to do general surgery because I knew I was leaning towards surgery, and my dad was a general surgeon. Loved it. So at the end of that year, I had asked my mentor, Dr. Brock Fair, who I should follow the next year. And he suggested Dr. Katarina Kieser, who is a gynecologic oncologist.
Wow.
So I went with her the next year, and I loved that. So we get into third year medicine, which is where you start to do your clinical work. The first 2 years are more didactic learning. The third and the fourth year are clinical based. And I sort of did back-to-back 3-month rotations in surgery and then obstetrics and gynecology. So it was great because I could compare them one right after the other.
Right.
And what it came down to for me was that I really liked the bread and butter of obstetrics and gynecology. I loved all the big crazy surgeries that you do in general surgery, the ruptured aneurysms, the transplants, but that's not your day to day.
Mind-blowing to me.
Yeah, it's amazing and it's super fun, but that's not your day to day.
Right.
But I loved gynecologic clinics and prenatal visits and regular deliveries. So when it came down to it, most of your life is going to be doing bread and butter. Right. So you have to enjoy what you're going to be spending most of your day doing.
That is such amazing foresight.
I had a lot of guidance from my parents, which was very lucky.
Yeah, that's great.
And the other thing that did help, and it's funny that you mentioned at the beginning, people are uncomfortable talking about women's health. I don't feel that. I have always felt very comfortable talking about women's health and women's bodies. And again, back to my parents, my mom did the Youth Health Center at Sydney Academy. So even when I was young, yes.
Wow.
Yep. Gail Bisson. Yeah, so she was obviously very comfortable talking to us. So that's the environment that I grew up in.
So that was your norm.
That was norm. So I never felt embarrassed about it. So I thought, well, I'd probably be pretty good at OBGYN because I like to talk about this stuff and I'm not embarrassed about it. So that led me down the path. And I finished medical school at Dalhousie and then spent 5 years of residency at the IWK in Halifax.
Amazing. Yeah.
I've pretty much been toying with the idea of coming back to Cape Breton ever since third year of medical school.
Wow.
But it all depended on whether I wanted to do general OBGYN or if I wanted to subspecialize. And after I had come here in my third year to do an elective with Erin McClellan, I loved being home. Loved it. I was happy the whole time. I loved the hospital. And it felt so comfortable. Like there is no hierarchy. Everybody is comfortable talking to each other. The patients are lovely. The people are lovely. So at that point, I decided I was coming home.
And that was in your third
year. So I actually got offered the job at that point and accepted it.
Amazing.
And then I spent a long 2.5 years waiting to complete my residency and come home.
Lucky for us.
It's
Goodness gracious.
lucky for me. It's so good to be home. It honestly has been what I had anticipated and what I had pictured. Wow. So I came back I finished residency in July of 2019, took a month off, did a locum here, and then opened my practice in September 2019. And then 6 months later, COVID-19 hit. Oh my God. So it's been an interesting introduction to my career as a staff OBGYN here.
Just starting it off in a global pandemic.
Yeah, no big deal.
No.
If you can do that, though, Jill, you can do anything.
Yeah.
Like, that has been a year for a lot, but for medical professionals especially, what a challenge.
It's been a crazy year. We always knew a pandemic was coming. They come. They always do. Yeah. And we were well overdue for one, historically speaking. But when it's actually happening, you realize we weren't really all that ready for all that time that we've had since 1918. Right. We were not all that ready. And I think we have been incredibly fortunate to be living in a time where we have easy access to virtual care. Right. Mm-hmm. And I think that has been a real game changer to keep things going and still be able to do care. Yeah. But it was tough. I was really lucky. I was able to adapt pretty well. I have an amazing administrative assistant who was able to adapt. So we were able to pretty much continue for me at full volume just by really staggering in-person visits with virtual care visits. Wow. It was a challenge. I ended up buying some more equipment for my office because we had limited space in ambulatory care and colposcopy clinics. Okay. So I bought some stuff so I could do things in my office. So that changed some things as well, things that I hadn't really pictured doing in that office. Right. I do. Right. So it's been a learning experience.
So as they say, like, you pivoted. You had to pivot, even in this field, Yeah. Wow.
And obviously, I don't think any of us got preparation as residents for how you were going to practice in a pandemic. Yeah, exactly. I think, it's great for the residents. Yeah. No. And we didn't really do virtual care. Right. Wow. Like, you didn't really do phone calls. I mean, you took phone calls as a resident from patients, so you got pretty good at documenting that. But that was in an emergency situation. It wasn't the routine visits. Right. It was, hey, I have this problem. What should I do? And then you would tell them to go to emerge or stay at home or whatever. Right. So it's very different than getting your history. Right. Finding out what's going on, starting from scratch has been very different.
And I assume even your communication behavior would have to adapt because you're not looking at the person in the face all of the time to even gauge if they're understanding it or not. Like, you have to be very clear and sure that, like, the verbal language and the jargon you're using is being understood by the patient.
Losing body language was huge. And I think there's no way to replace it. Right. Things were lost by not having that face-to-face. Wow. So most people I was able to bring in eventually. You just had to wait, but you kind of figured out if people needed to be seen sooner or later and how you're going to do it. But it was challenging to lose facial expressions and body language. And then, frankly, we were all at home. Right. So we were doing it with kids screaming in the background, dogs barking, cats meowing, the phone ringing. So your attention was not necessarily fully on the physician speaking to you. Right. So that was challenging, but we adapted. Yes. Yeah. I made a lot of pamphlets to email people.
But see, all of these skills that you had, like you said, you didn't necessarily plan for when opening your practice. And then all of a sudden, you have to learn and adapt and implement all these new skills and strategies while still providing care and practicing medicine. That's not necessarily part of your day-to-day otherwise.
And now it has become it, which is so weird. But everybody was so worried about virtual care, but that never really bothered me because at the end of the day, I still had my office space. Right. So if I was on the phone and I had any concerns and felt that I needed to see someone right away or within that week, you can bring them in. Right. Yeah. It's not like you were shut out of your space. Right. So it wasn't ideal, but it worked.
Right. Wow, that's amazing. You know what? When you started speaking, I just had, when you said you were interested in neuroscience, I had like McDreamy pop into my mind. Like, she's McDreamy. Yeah. Grey's Anatomy. Yeah. And then general surgery came into your mind. And then I was like, she's Meredith. Oh my God, she's all the stars. And then I thought about so Dr. McMullen delivered the twin boys and my twins, and I remember being wheeled back, and I think I was commenting, I don't know, I was probably out of it, but I was commenting on your scrub cap maybe, and I think I made a Grey's Anatomy reference, and you started laughing, and then we talked about all the ways that Grey's Anatomy gets it wrong, like all the things they don't show or they do wrong or whatever. But do you have, I'm curious to know, any like any routines or any superstitions or any things that you need to do before you go into that OR or before you go into whatever scenario? What gives you your like comfort and confidence before you walk in? Is it that superhero pose? I think that's what Meredith does. I don't know, my Grey's Anatomy fans out there will know, but
It's so boring because it really is preparation. Yeah. So I read through the entire chart the night before just to reacquaint myself with the history. Because sometimes for these people, I've been seeing them for 2 years.
Right.
And I know why we're doing the surgery and I know their history, but I might have forgotten some details. So I like to read the whole chart, every piece of imaging, every lab work that I have the night before. And then I do a lot of visualization. I used to show horses.
Yes.
And my coach had me, imagine the ride the night before.
Right.
Picture it. So I started doing that with surgery of like picturing, okay, right from the start, how am I going to position the patient, what I'm going to do, what happens if I get into trouble, what if there's scar tissue that I don't expect, what if there's bleeding. Right. So picturing every step and just as I'm laying in bed, literally running through every case.
Wow.
And trying to, because I've just read those charts, I can picture like, okay, this patient has this history. She's had 3 vaginal deliveries or whatever. Right. So I can really picture that patient and do that. The morning of, the main thing is just get as much coffee into your body as you can.
Right.
I should probably say like eat a good breakfast and pack food because that's what you're told. That's what you're told as a medical student because like often people will pass out, especially in the OR. I'm terrible. I have a banana and then I won't eat all day. Our friend Jenna is always saying, "Did you actually bring a lunch today?"
Right.
No, never have.
Wow.
It's if I can get the coffee in,
Right.
we're good.
Right.
And then really like before the OR, no, it's just more chatting with the patient. I like to speak to my patient beforehand, just make sure that they don't have any last minute questions, speak to the anesthetist so they know if I have any concerns or any special things that I'm worried about or things that I might do differently than the routine. Right. And then, you have scrub hats that wouldn't necessarily be lucky, but like from October 1st to October 31st, it's Halloween.
Yeah, I love that.
From November 1st to December 25th, it's Christmas. Yeah. But I have a lot of superhero or crown scrub hats that I do like to wear.
that's amazing.
I love that.
But no, like poses.
Right.
I mean, we did do that once for a hard case in residency, and it felt great, but I just don't think of it in the moment.
It does change your physiological responses. It does when you stand in that power pose for a few minutes.
Does.
Yeah,
And
it does
felt
build your
great when we
confidence.
did it,
Yeah.
Honestly, like it is so hectic
Yes.
because often you see your patient, you chat with them, and then you have to go round and then you run back to start the case. But I like to be there with the patient when they're going asleep. So you're running back and you might, I'm thinking to do those things like take a minute, do some meditation. Yeah. It happens probably once every 6 months to be honest.
What's the longest surgery you've ever done? Because you say you don't bring a lunch, so I'm thinking, like, how long are you in there for?
Typically, gynecologic surgery, and this was a pro for me, typically, if it's not oncologic surgery and I don't do any gyne oncology surgeries, they typically at longest would be about 3 hours. Mm-hmm. So it's not too bad. There are always times where you get into cases that are more challenging than you expected, that have more disease than you expected, and then maybe you creep up. But the longest surgeries I would have done would have been when I was doing my general surgery rotations in medical school and in residency. Probably, I think in residency, in my general surgery rotation, I would have done a 6-hour case on call. That probably would have been my longest, but that in my life now is not routine. Most of them, I would say, the longest surgery I would do these days would be a laparoscopic hysterectomy.
I was just going to,
Wow.
Yeah.
And that, I am still only 2 years out in my career. So I give myself lots of time because I know nothing is going to stress me out more than the possibility of being late. So I'll book those for 3 hours. And I typically finish it in like an hour and a half. But then you can just get more cases done. It's all good.
Wow, what a go-getter. Also, you and Jessica share that, the not wanting to be late.
Oh.
Yeah, peace. Yeah.
I can't
My stress
either.
response just
Same.
Yeah.
To me, being on time is
is
late.
late. You are late. If
I'm
you are
late.
on time.
Ladies,
Agreed.
I am sorry. I love you both dearly, but Jessica was at the bottom of my street today, like 45 minutes early.
Parked in
respect
the
that, Jessica.
Thank you.
And I saw it, and I was stressed because I was like, wait, I thought we agreed on 6:45, and now she's here 30 minutes early. So I'm on time, usually. Sometimes I'm late. But it's not out of a lack of respect or care. It's just my inability to be on time. Yeah, sorry.
I panic. So I know my family doctor, it's automatically, you're waiting 2 hours
Right.
before you see him,
Right.
no matter what. But you get it back when you're in his office because he will take his time with
Right.
you. But you just have to like wait it out
Yeah.
for your turn. I still show up a half hour early,
Wow.
even though I know I have to wait 2 hours. But if I show up on time one day or 5 minutes late, that could be the day that
Yeah,
he
that's
was on
right.
time.
That's
And
right.
I
It's
run
a
late.
respect.
Tight ship. I never run more. I have not ever run unless I get called up. Like if I'm on call, you can get called for a C-section, whatever. Then you're running late. But if it's a normal day, like I don't run more than 10 minutes late. I run a tight ship.
Okay, so we're all in our 30s. What are just some general like tips for our health, like our vaginal health? Is
Yeah,
that
like
what we call it?
let's just say vaginas. Can we just
Okay.
say it? Vagina.
Vagina.
Vagina. It's good. Say it. Say it out loud,
actually,
people.
the more I say it though, the nicer it seems because the word to me is a little bit, I don't know, vagina.
Yeah, but you're saying it that way.
Because I
That
feel
response
it
to
that
it.
way.
It
Like
is so
vagina.
So
conditioned.
conditioned.
Vulva sounds so much nicer.
Well,
I disagree.
yeah.
Vulva. And I like vulvar dermatology, so I say vulva every day.
Well, we've read your bio, and the listeners have heard it, and we're like, vulva dermatology. We got to ask her about that. We didn't even know that was a thing.
That is like my thing that I really, really love. One of the many things that I'm passionate about in gynecology. But vulvar dermatology or gynecologic dermatology is the study, diagnosis, workup, and treatment of any skin diseases affecting the vulva. Okay. Gynecologic dermatology would expand that and include the vagina as well. Okay. And that can be anything from things as simple as allergic reactions and yeast infections to things that are autoimmune in nature, like lichen sclerosis, to things that are precancerous or malignant. Okay. So when I came here, I had started a gynecologic dermatology clinic with Stacy Northgrave, who's one of the dermatologists here, based off a clinic up in Halifax, which is run by Dr. Isabel Delisle and Dr. Mary Lou Baxter. So the idea is you have a gynecologist and a dermatologist in the same clinic. Amazing. And often Dr. Northgrave and I will go in and it's clear we don't need to consult each other. But for those more challenging cases, we have each other. But I think vulvar dermatology, one of the reasons I like it so much is because that's the thing that nobody wants to talk about. Okay. The itchy scratchies, the discharge, the bumps, the lumps, the things that don't look normal down below or that you think don't look normal. Right. And 9 times out of 10, it's that you think it's not normal.
Right, because you're not taught, A, what's normal, and B, how to even look for that.
I was just going to say, who's even looking down
Yeah, are
there?
we even encouraged to like check it out and be familiar with it? And
I'm too scared to look because what if I see something that freaks me out that's normal, but like the color of it? Yeah. Like the color of around there.
right. Well, I was just going to say, maybe explain to our listeners the difference between, you said like vulvar and vaginal, like vagina and vulva. What?
So it's pretty easy. Vulva is outside, vagina is inside.
Okay.
That's as simple as that. Great question. It's a misnomer. It drives me crazy. That is my bugaboo.
Okay.
But if it's on the outside, it's vulva. Yes.
So we should be teaching children that it's your vulva,
vulva.
not your
Yeah.
vagina.
The vagina is inside.
What the fuck?
Okay, my mind is blown. I knew I,
feel
was
like it's
going to
like,
learn.
You know that meme where it's like, how old
I was today years old. Yeah. I think everybody listening just said, "Oh, what? Today years old." So, and I've said this a million times, but like language is so important and communication is so important. And there's so many things in our life that like influence our perceptions and our understanding, and we're conditioned in certain ways. And language is the foundation of all of that. And this is just such a clear example. I mean, we've lived how many years with a vagina and with a vulva?
Vulva.
And I've been calling it a vagina.
I guarantee that parents would be 10 times more comfortable teaching their children that it's called a vulva than a vagina.
Yep.
Guaranteed.
You think?
I 100%
I
think.
kind of side with Jill here. Like vagina sounds easier for me to say than vulva.
Yeah.
Vulva sounds so like vulva. Like, ooh.
sounds clinical.
Right.
It sounds very clinical.
Okay.
Right. Because not a lot of people are familiar with
Yes.
it.
I'm the odd one
Yes.
out here then.
Yeah, interesting.
I feel like vulva sounds more attractive than vagina.
We'll have to throw up a poll. See
We
what the
will.
listeners think, vagina or vulva.
Well,
So-
it's vulva.
So vulva on the outside, vagina on the inside. So that itchy, scratchy, uncomfortable, discharge, all of that stuff, we call that's vulva.
Vaginal discharge.
It can be either.
Vaginal,
Okay.
that makes sense, right?
Right.
And that's the trick, because often someone will come and just say, my vagina's itchy, or I've got a lesion on my vagina, or I've got a bump on my vagina, or even you'll get consults from other physicians saying a vaginal lesion. And my job as a gynecologist, and within my special interest of gyne dermatology, is to, first of all, find out what is actually going on and where is the problem actually starting out from. When it comes to the itch and the scratch, aside from yeast infections, most of the time it's coming from problems on the vulva, on the outside. Discharge is almost always from the vagina.
Okay.
Right. So, just put this in perspective. So, someone with like a lesion or whatever, that's being found during a pap test, I'm assuming, or like
Typically, but sometimes people just feel something when they're in the shower, or their partner feels something or sees something and brings it to their attention. So I would say it's probably a 50-50 split of people finding it themselves, or physicians finding it when they go for a pap test, or because they have another complaint. Maybe their periods have gone wonky and they have that exam and it's, oh, well, your periods are wonky, but also.
Right.
yeah.
Okay, so I'm going to circle back. I don't like saying that, but I'm going to do it. Circle back to Jessica's question because all of this is so fascinating. I think it's so important for us to know.
Absolutely.
And maybe that is one of the things you wish women knew. So what are some things that you think women in their 30s should be aware of, cognizant of, looking for, taking care of themselves in what ways? Like what are some important, highlight reel of things that we have to be...
Well, I mean, I could do a podcast of my own of this. Not as good as you guys, but some of the big hitters. The first is related to cervical cancer. Okay. And I think we had talked a little bit about this, Sarah, you and I. Yes. We are so lucky to live in the country that we do with free medical care. Right. Mm-hmm. Yes. And because people have, for the most part, reasonable access to pap tests and to screening, we have very low incidence of cervical cancer. So now in Western world and industrialized countries, the people who most often get cervical cancer are the people who are not getting their pap tests, who are putting it off. Right. So that is the number one thing. Get your pap tests. Right. And under that same umbrella, if you are under 45, you are eligible for the Gardasil vaccine.
I'm in the process of getting mine. Yes. I've got 2 injections so far, and I have 1 more in a couple months.
The 3 best things you can do to prevent cervical cancer: get your pap test, get Gardasil, and don't smoke.
But I have an interest.
Okay.
So I have a question about that though. So the reason that my doctor wanted me to get this was because I did have HPV. It was found in a pap, and so LSIL cells. I didn't know this at the time. I don't think I was informed, but I was supposed to go back like 6 months later for another one. But anyway, time went by and I didn't because I didn't know. I would 100% go to an appointment. Like, there's no, I have a lot of anxiety, but I would not miss an appointment. Right. So anyway, my pap, I just had a pap in January, came back good, but he wants me to go every 6 months until I get like, so you get I think forever or something he wants me to go.
2 clears and then you should be okay.
But yearly, I think he wants me to still go? I don't know.
Not with LSIL. So the thing with pap test screening, and to get it, to give people advice in terms of the nitty gritty of how often, that can be a bit challenging because it is different from province to province and country to country. Okay. In general, most of the provinces are moving to starting at age 25 or 3 years after you start having intercourse, whichever comes later.
Okay, say that again.
So 3 years after the first time you have sex, or age 25, whichever is last.
Okay.
So can you myth bust this then, or maybe it is true. So I didn't think that the Gardasil vaccine would be helpful to me because I've had multiple sex partners.
Right. So I can absolutely myth bust that.
Okay.
It's still helpful.
It's still helpful.
So the Gardasil vaccine is protecting you against the strains of HPV that cause or that are most associated with cervical cancer.
Right.
And other cancers such as anal cancer and vulvar cancer and throat cancer. But it's those cancer-causing strains.
Okay.
With that said, there are many, 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 many strains of HPV. Some don't cause any problem. Some just cause some mild abnormalities on pap tests. Some cause warts, but they don't cause cancer.
Okay.
So just because you've had abnormal paps or because you've had multiple sex partners does not mean that you can't benefit from the Gardasil vaccine, because you would not necessarily have been exposed to those cancer-causing viruses.
Right. So the way he explained it to me was like, it's basically like you have a virus in your vagina. So like just as if you were to get like the flu or like whatever, there's different strains of the flu when you had a virus in your vagina and then it cleared up.
Exactly.
But it could come back or a different. So I actually had, when we talked about this on one of our first episodes, I had someone message that said like, thank you for talking about this, because they felt like to admit that you had HPV makes you look extremely dirty.
Right.
And that is crazy, because 75% of people who are sexually active in their lifetime will contract HPV.
So regardless of your current relationship status, the amount of partners you had,
You're
under
under
45, you should be getting.
It is recommended. Even if you've had precancer of the cervix, we still recommend it.
Okay.
So
I don't think I have a Gardasil vaccine, so I should get
So we
that.
missed the boat, Sarah. So just after, it would have been a couple years older than me.
Yes.
So
thanks for that. but
Sorry,
yes.
I'm just trying to put it into perspective. I think it was a year after I graduated went to high school. They started offering in junior high, so grade 12.
Okay.
Or sorry, age 12. Maybe it was
Oh.
grade 6, but it's great. I think it's grade 7 that
Okay.
children
I
are offered.
grade 7.
Yeah. So a little bit. I'm sorry, my math's not great. We've realized this recently. So we missed the boat on that. So now it's offered. So we went through and didn't get it. So if we didn't have a parent that advocated for it, we
Right.
didn't know.
Okay.
So like my friend, whose father is a doctor, made sure that she got that vaccine.
Okay.
I never got it just because probably my parents didn't really know it was a thing.
And when it first came out, there was a lot of fear-mongering around it, like there is with every vaccination, as we are way too familiar with. And then there was a lot of bizarre stuff. People thought that it would encourage sexual activity in their teenagers.
Do you think it's because it's for women?
Yes. I think it's because it's related to sexual health.
Right.
And all it takes is one partner,
Right.
right? And if that one partner has a cervical cancer causing strain of the virus, you might develop cervical cancer. So it is recommended. Downside is it is not covered by pharmacare.
Okay.
So some plans cover it. Some people have to pay out of pocket. The company can help based on certain criteria that I don't know the details offhand. But it's definitely worth talking to. Your family doctor can give it. You can even talk to pharmacists. Some of them will.
Okay.
Yeah. So worth doing.
So if you're in a long-term relationship, monogamous relationship, you and your partner together, in the foreseeable future, just you and them, you still get it if you don't have it.
I would still recommend it, especially if either one of you have had sexual partners before. Even if it was just one.
Because it can be sitting.
Because you just need one. Right.
Is it? I don't
all
think
of
it
the
is sitting
past.
there though, right? Because
It can. So it takes time. You don't get the virus and get cancer tomorrow.
Right.
You get the virus, it causes changes in the cells. The cells then start to invade.
Okay.
Then they become cancer. And it takes over 10 years for this to happen. So that's why we're pushing back that start time to getting PAPs, because what was happening was we were screening girls as soon as they started to have sex. We were picking up these positives, and when you're young and you're super healthy, sometimes your immune system clears that. And so we were doing these interventions with young women, with girls who would have cleared it on their own. They were having complications or consequences of having these treatments when they may not have needed it.
Okay.
So we've pushed it back now, and in some provinces it's still 21, in some it's 23, some it's 25, so it is best to check where you are. And the US is different as well. And this is an evolving science because now we're getting HPV testing. So it's still going to change even further. So the recommendations, the PAP test recommendations are challenging for anybody. And it is one of those things that is kind of mind-boggling. because you always have to update. Because once we get the HPV testing, it would be like you get a PAP and an HPV test, and then depending on the results, there will be like 3 different pathways.
Okay.
But for now, it's age 25 or 3 years after first intercourse.
Okay.
Then you go every 3 years, so long as your PAP tests are normal.
Okay.
If you have high-grade abnormalities on your PAP tests, then you see a gynecologist right away.
Okay.
Okay.
You don't pass go, straight to the gynae.
Right.
If it's low-grade changes like LSIL or ASCUS, ASCUS, you repeat it in 6 months. And then depending on those results, you may end up going to the gyno or you'd go back to your routine screening.
Okay.
Once you've had precancerous changes of the cervix, so that is HSIL, so high-grade squamous intraepithelial lesion, then you are on to the annual PAPs for life, no matter what. Even if you have a hysterectomy, still need it.
Okay.
Because HPV can affect everywhere. It's the cervix, the vagina, the vulva, the anus, throat. Throat from oral sex. And also, some gynecologists have actually gotten throat cancer from doing LEEP procedures where they are treating cervical dysplasia or cervical cancer. The virus got aerosolized and inhaled.
What?
And they got
We have a follower messaged us, so it's one of my like friends, and she is an OR nurse, and she said that she wondered about the Gardasil vaccine, and if I think her question was like, how much was it covered, because they're recommending, that they get it because from doing cervical cancer surgery.
Yeah.
Wow.
So now we have good masks to help with that, but we didn't know, and we didn't have Gardasil.
Right.
So, but yeah.
Wow.
Yeah.
That's fascinating. So
It's a scary little virus for something that is so common.
Right.
And the other thing is with the Gardasil, that's a vaccine that can prevent cancer.
Right.
It's 95% effective in preventing cancer. We don't have anything else that's no other vaccines that would prevent cancer.
Right. That's a no.
Because if there was a vaccine that would prevent breast cancer, we'd be lining up.
Right. Exactly.
We would, out the door, it would be sold out.
That's right.
So Jill, for just anyone listening, how often should people getting PAP? Like, let's just say their PAPs are good. Is it every 3 years?
Yeah. If they've all been okay.
Every 3 years. Yeah. So this is your
certain subgroups of people, like if you're immunocompromised, and there's very specific scenarios for that where you might need to get it annually. But the guidelines around that are a little bit hazier and a little bit less clear cut, and different provinces again do different things. Right. So when in doubt, the best thing is just to consult your physician or your gynecologist. But in general, if you're healthy, no medical conditions, your PAPs have all been perfect, every 3 years. Okay. And then you stop at 70.
Oh, do you? So I have one last question. So my husband, when he found out all this, like, okay, you have all these LSIL cells, whatever, he's like, you're getting the Gardasil vaccine. He's like, should I get the Gardasil vaccine?
Men can get it. I think they're actually vaccinating boys now.
Oh, wow.
And I was like, I don't think, but I don't know. Because he's wondering, like, if you had it, the HPV, like, could I have had it?
Yes.
Because
absolutely possible. Yeah. Because it is technically sexually transmitted and through the air, as we found out.
Wow.
So, and even through like shared sex toys. Right. Like that little virus. It's a nasty little virus.
We had someone message when I said that. So I was in this dilemma of like, the day that the COVID vaccine came out for my age group was the day I was due for my Gardasil, my second dose. So I was like spiraling because I was like, I want my COVID vaccine so badly. Yeah. So I was texting my pharmacist, who was my cousin, and she was consulting with public health. And public health and her were both saying like, I know it sucks, but like this vaccine is just important. I was mentioning my girlfriends being like, I don't think I can get this Gardasil vaccine. Do I just let it go? Because I need the COVID vaccine. Yeah. And they're like, first of all, you need to be thankful that you're getting both of these. Like, lucky you that you get to get both vaccines. Like, just take a deep breath, take a step back. But like, COVID is so
pertinent.
We're right in the middle of the third wave, which was the scariest of them all.
Yeah.
But I had someone message that thanked me for sharing it, because I don't know her whole experience. She didn't share it, but she said like, I hope this is a podcast episode one day, because she said she wants people to be more aware of the Gardasil vaccine and how important it is and how it can save lives. And so I'm so glad we're chatting about that,
me
because
too.
how many others?
Yeah. And I think this is a good reminder for all of you listening. Like, when was your last PAP test? Mm-hmm. When was your last PAP test? And go schedule it.
Mm-hmm. And I look it up for everybody.
Wow.
I actually look in the electronic record to actually
good
check,
for you.
because our memories aren't good.
Yeah, that's right. That's right. It's so true. And I think it's also important, like you heard it here from a gynae, like it's okay to have itchy, scratchy. It's okay to ask these questions. It's okay. Like, you're not judging the person coming in,
Okay.
right? Like,
Well, let's-
I'll use my personal example. Like, I'm breastfeeding. That changes my hormone. Is it estrogen?
So it puts you in a low estrogen state.
Right, which can affect your vulva, not my vagina. Both. Okay. So my vulva dermatology in this sense was being affected, and I did feel a little itchy, scratchy, and I was scared to mention it because I thought, I don't want Dr. McMullen to think I'm not clean or that I'm, whatever, not taking care of myself or that something's going on down there. And you were the one to ask me about it after an exam. And I said, yeah, it is. And you were like, Sarah, you could ask me about that. And I so appreciated that because it's creating that comfortable space. But I think we worry, like you just said, we've always kind of been told not to talk about it. And then you feel dirty or not clean or that it's something. But I mean, if I had an itchy arm, I'd feel no bones about it by saying like, I have an itchy arm, guys. Why is my arm itchy? And I would get it checked, right?
So can we break that, sorry.
Yeah, go for it.
Can we break that down? Okay, so so I know for like the obvious one, why people are not really comfortable getting PAPs could potentially is that you have a male doctor. Like I know that's a lot, but can we break down like when you're doing a PAP test, like break that down for us, like you're not seeing anything that you don't need to see. No. Like break that down. Like we don't need to be uncomfortable, right? Like I guess
so for us, we're laying on the table thinking,
she's
vagina.
She's
And you're
staring
probably
at my
looking at
vagina.
it like it's looking at our faces. Yes. Like you see them every day.
Yeah. Honestly, especially if you're in gynecology, like that is what you're doing all day, every day.
Right.
Every week, every month, every year.
Right.
Like I don't remember.
Right. Yeah.
Like I wouldn't meet you in the supermarket and be like, I remember what her vulva looks like. I don't.
Right.
I don't.
Right.
And it is what we do every day.
Yes.
And I know people are nervous about it, and there is hesitancy around male doctors. We are lucky here in that we have the Well Women's Clinic, which is run by women. Right. So you do have that option to go to a female physician. Right. So that option is available. Some physicians' office have nurse practitioners who are female that you could ask for, or nurses who do PAP tests that you could ask for. Sometimes you luck out and you have a female medical student or resident who happens to be there. Yeah. So you're right. The male physician is one thing. The discomfort is another. Right. It's not a comfortable test. Like we get that. Right. We don't think it's a good time. We don't think everybody wants to have it. Right. But cervical cancer is horrible. It's a horrible disease to have. It's a horrible death to die from. Right. So I'm not minimizing that discomfort. But when you see the consequences of untreated or unrecognized cervical cancer, and you see so much in the third world where they don't have as much access, it's worth it. Right. And like, trust me, your gynecologist hates getting a PAP as much as you do. Right. Like, we're not good at it. We're being told, like, come down the bed more, scooch, scooch, scooch. Like, I know. Like, I know this. This is what I do every day, but you don't like it.
What's the trick to the
I'm
scoop?
calling it right now. Can you make, like, on the bed, maybe have, like, a piece of tape where it's like, hey, put your arse right there. Just start it right there.
There is a trick.
Okay, what's the trick to the scoot?
But people, I don't know if people just don't believe me, but put your tailbone right at the edge of the bed.
Oh. I know.
You're going to feel like you fall, or you're about to fall off. I have not had one person fall off.
Right.
So
I still feel like I'm like, no, I'm going to let the nurse torture me for the next 10 minutes.
Scoot.
And it's not your fault. The other thing, too, is when you lie down, your pelvis tilts. Yeah. So you could have felt like when you're sitting upright, I'm right on the edge of the bed. I can't possibly go down more. As soon as you lie down, your pelvis is tilted back and you are like 3 inches up. Right. And you didn't do anything wrong. It's your anatomy.
Right. I just feel like I'm not voluntarily going to like go up there and then let my legs flail and fall and let the air just cool off, like the drift, go on my vagina, my vulva. And unless someone's telling me to do so. Like, I'm just not voluntarily doing it.
Fine. Like, we don't mind. We understand. But if you want to get as close as you can on the first try, find your tailbone, put it right at that edge of the bed, and then lean back.
Oh, that's a good tip. I'm trying that.
The other thing, too, to make PAP tests or any pelvic exam more comfortable, it's muscle tension that makes it uncomfortable. Yes. Okay. So one thing, we talk about letting your knees fall to the side. Yes. We're not just being jerks. That forces some of your muscles to relax. Right. And the other thing is to imagine from your tailbone or from your bum that you've got like a heaviness, like a weight pulling you down, and sink into the bed. Oh. And that again will force you to relax.
That's a great tip.
Because I feel, like I feel like I'm holding my stomach. Yep. Like I feel like that's what I'm doing. I'm like,
you're tightening those muscles.
and then I can feel the speculum go in, and then I'm like,
Right.
I'm not
But you're doing that
relaxing at
because you're
all.
tense, right?
100%.
But if you're relaxed, it's easier on you, and I'm assuming easier for you.
Yeah, absolutely. It is, but that's not the main thing. The main thing is the relaxation for the patient, but no one's going to like it. No one's going to be able to relax being like, oh, whatever, it's just a pap. Right. So you're better off to do that imagery of something is pulling my bum down. Okay. That is the easiest way to do it, because then you can focus on something else besides it, but also focus on something that's going to be productive and achieve your end result.
That's a great tip.
This is so great. So can we do some more myth busting? I know
I
there's
love
like
myth
a lot of
busting.
different things, but I just feel like this is like a really good role we're on.
Myth busting is fun.
Yes, you're gonna hate me because I always do this, but I have a funny story about what you just said. Like, I won't remember your vagina. Like, I'm not looking at you in the supermarket and being like, know exactly what you look like down there. And after I had Bo for that exam, you take the baby in a few days later, and they were checking me as well. The nurse in the clinic, perinatal clinic at the time, I went to school with. So she was a year younger than me, but we knew each other. We were friends. Yeah. And she said, Sarah, if you're uncomfortable, I can get another nurse in. And I laughed and thought, I have zero dignity left, so I don't care. If you're comfortable, go for it. If you're not comfortable, get someone else. And she had said exactly that. She said, well, no offense, but I won't remember what your vagina looks like. It's like looking at feet for me. Like, it's not you, it's me.
Like, no offense
not that you don't have a memorable vagina, just I'm not going to remember it. So then I was like, I appreciate that.
So that's a segue into what I was going to ask next. Right. Let's myth bust. All vaginas are the same.
Nope.
They're not, right?
Nope.
But like, okay, why are we so, I mean, I'm always just like, is my vagina normal?
If you're
there's
worried, ask your doctor.
But there's no normal. No, I'm not. Normal. No, I have a male doctor. Like, there's no way I would ever like. He's like 80. No, I can't ask him. Yeah. When I get a referral to get my IUD removed from you, we'll chat. Yeah. But like seriously, like vaginas are also different, and I feel like due to like. I don't know. Like, I feel like here's the thing you see on the internet. Porn. Okay, thank you. Thank you. I'm like looking at mine, and then I'm like looking at the porn, and I'm like, okay, like one of these does not look like the other, and it's mine.
Okay, so I actually never thought about this before. I think I kind of assumed that all vaginas did look very similar. So is it like faces?
You had the porn one then?
No, but no, I don't mean not that mine looks like that.
Like,
I just meant like a vagina. It's like what we see on the chart.
Like we all have a nose.
Yes.
Yeah. Like you all have the opening to the vagina. Everybody has a clitoris. Everyone has a perineum, which is that area between the vagina and the anus.
Right. Mine's
Everyone has labia. Like there's subtle differences, but you're exactly right, Sarah. It's like faces.
Okay, that's what I was just going to say.
Like,
so
we all have
a face.
We're different.
Parts.
We're the same.
Yeah.
So we all have faces, but our faces look very different.
But we all have a face.
But we all have a face that have similar things on it. So our vaginas are the same in the way that our faces are the same. Yes. Is that fair?
Yes.
So you see lots of different.
So many.
Right.
And what's the range
they're all
of normal?
Oh my God, that is, there's an infinite range, right? Okay. Like everybody's face is different, everybody's vulva and everybody's vagina is different. Right. And it changes through your life. Yeah. It changes through if you have babies, if you don't have babies, if you have procedures, if you need to have a procedure for precancer of the cervix. Like it's not something that's static.
Episiotomy, it changes down.
It changes. So it's not static throughout your life.
Right.
It certainly changes with puberty. Right. And then again with menopause.
So like our bodies.
It's like your bodies. The vulva and the vagina are just part of your body.
Right.
They change like your body.
Oh, can
They're
we
nothing to be embarrassed or
like
scared of.
That?
Yeah.
Yeah, but
they're just part of our bodies.
But this is society. Like this is what we.
I know, but we have to stop that.
I know. Well, we are right now.
Yeah.
Yeah. Talking about it.
I don't have a porn vagina, but I have a wicked ass.
Does anyone have a porn vagina though? I don't.
I mean,
they
some do.
editing. I'm assuming,
right. Yeah.
Right?
Those are photoshopped.
Yeah.
Yeah. Okay. This question came to my mind. It wasn't on the list, but what type of gynecologist does a gynecologist go see? Like, you must really have to trust. It's like a therapist going to therapy.
Yeah.
You must really trust, like,
I mean, at the end of the day, most common things like pap tests, family doctors can do.
Okay. Right.
So
yes,
again,
that's right.
no difference.
Right.
You would go to your family doctor.
Right.
Especially you have a relationship with them.
Right.
They know your history. But then again, I think it's because we do that training, we see what the different subspecialties are. You become acutely aware of like, okay, this is related to endocrinology, this is related to urogynecology, and then you would just direct yourself there. But then again, like you're talking about like your friend, I don't care, or like you went to high school, you don't care. We as colleagues, I've had colleagues as patients, I've had friends as patients. It's really and I think as a gynecologist, like you are so numb to like being embarrassed about these kind of things. Like you're just so used to it.
Right. Yeah.
Yeah.
And
That's
you'd rather your patient ask you all the things, right?
Yes.
Like you'd rather
I would
them
rather people ask me the questions and let me know what they're thinking and let me know what they're worried about than going home and feeling like we didn't do what's best for them. We didn't listen. They don't really feel confident. Like you're better to ask. And if, I not all of the time, but not infrequently have patients who I have the conversation with and they call back to my secretary and say like, I want to talk again about the different options. And that's fine.
Right. Yeah.
I feel like Jill's wait list is gonna increase.
After this episode,
oh
like,
Lord.
gosh, I don't know if it can get any bigger, but yes, I know. And I can speak from experience, and I'm very grateful for my experience. And I've talked about this in different ways and to different people that our experience with Dr. McMullen delivering the twins, following us through that pregnancy was incredible. Like I just feel so grateful for it. But I also am grateful that you were able to give us, you advocated for us, but you also created an environment that we felt we could advocate for ourselves.
Yeah.
And I think it's really important as women, like we've talked about the imposter syndrome and we've talked about all these things that we feel like we kind of get in our own way sometimes. So what is a tip for someone who might not be as comfortable to advocate for themselves? Like what's a tool that they can use? Like, is it just being comfortable to ask all the questions, or what is something they can do to advocate for themselves in that way?
I mean, the main number one thing, and it's easy to say, is just ask the questions because the physicians really don't care and we'd rather know, but that's easy to say. Right. You might not feel that way. One way to couch it, which would be fine, would be if you don't really want to say like, I'm really worried about one of my labia being longer. You could always just say like, I heard about people who have labia that are asymmetrical.
Right.
Can you tell me about that?
Right.
And you can put it as it's not me, it's somebody
general.
else, and you
I
just
like
want
that.
information.
Well, I would be like, I read this interesting article. Do you
Yeah,
know anything
you can-
about
and
it?
that's
Like asking
fine.
for a
Right.
friend.
Yeah,
you
and
know?
you can do that if you feel like you don't want to link it back to you. And then the other thing too, if you read specific things, it's really hard to talk about an article or a post or a story that you have not read or seen yourself. Right. Like it's very hard for me if someone says, well, my sister had this experience with this. Right. I don't know her history. Right. I don't know anything about her health or her anatomy or her past. Right. And all that plays into everything. Right. So without knowing that, I can't really comment on that story. Right. If you tell me, oh, well, I saw a post on Facebook that said this, unless I actually read it, I don't really know. And I still don't know that person's history. But if you have an article that you're worried about or a post, screenshot it, bring it in. Right. It's so much easier to actually address a question if you're asking about something specific that you've seen or you read. It's easier for me if you bring it in so I can see and read the same thing so that we're meeting in the middle and we're not talking over each other.
Right.
And is that true for pictures as well? Like if I notice something down there, my lady bits, and I'm like, that looks odd. I snap a picture of it because maybe at our next appointment, that's in a few weeks, it's not there anymore.
Pictures are
like,
great.
is that
absolutely.
Okay.
And it's very helpful because like you said, sometimes things come and they go. Right. Yeah. And it's hard. Like I try my best to keep an open schedule, but it's next to impossible. And with some of these things, like they can be there one day and gone the next. Right. So even if I got you in the next day, it could be gone. Right. So lumps, bumps, things that don't look right, taking pictures is very helpful because I can see what you're actually seeing. Right. And at that time that you were seeing. Because like you said, by the time you get in, it could be gone. Yeah. Even if it is the next day, it could be gone. Yeah. So I need to see what it was when you were
right.
This has been so just interesting and helpful. And I know that we have a million things more that we want to touch on, but we can't touch on everything today just due to time. But we would love, and you don't have to answer this right now, but like it would be so cool to do this. I don't know what would even be like a reasonable schedule, but like check in with the gyno.
Yeah.
Like on
I don't know, like a
Or a regular segment. Like
fun.
ask your OBGYN.
Right,
love
because I feel like we have there's just so much more to talk about, and we obviously can't get to it all.
One of our listeners asked, and I've heard this from friends and family members and etc. Knock on wood, like I'm not there yet, so I don't know. Maybe I'll be in this category too. But one of our listeners wants to know, is it
Ooh, this is a
normal
good one,
for
yeah.
periods to be 10 times worse after baby? This specific listeners came back 9 months postpartum, and she said she's now down and out for like a good 7 days. Yeah. So we know as like
I heard this a lot
professionals,
from friends,
sometimes
too.
that's a lot, 7 days. If you're working, you're a mom,
Oh,
you're
yeah.
trying to figure, your life out.
If you're a mom,
Yeah.
geez, that's a lot of
So,
time.
so hers came back 9 months postpartum, 10 times worse after baby. Is that normal?
So it can go either way. Your periods can be worse or they can be better.
Okay.
And it's hard to predict who is going to fall under which category or if your periods are going to be completely the same.
Okay.
And if you think about it, the uterus goes from being the size to contain a term baby with with the placenta and the fluid and everything, and then has to shrink back down to the size of your fist.
Wow.
So it remodels itself and it changes, and some people have benefit from those changes. Maybe it's such that their anatomy has changed, such that they have better periods. Maybe it's worse.
Okay.
So I wouldn't be worried that the periods have changed,
Okay.
but being down and out with a period for 7 days or for any length of time, really, that's not a way to live.
Okay.
And now we're moving more with gynecology to when we consider abnormal
Yes.
bleeding, it's more based on the subjective symptoms if it is interfering with your life, because your heavy might be different than
Right,
Jess or
right,
mine.
right,
Your
exactly.
degree of pain might be different.
Right.
So it's more how it affects you.
Yeah.
So I would say if you're down and out for 7 days, you need to talk to your doctor about that, because there's a lot we can do. There's no need in 2021 to be out for a week of a month.
Right.
No need for that.
That's a, like long.
That is a lot of time. So absolutely ask. There are things that you can do. You don't have to live like that.
And that's the piece where you have to advocate for yourself, right? Like if she runs into a healthcare professional who says, "Oh, well, that's just normal. There's nothing I can do." She has to push back and say, "Well, I don't think it's normal. Like,
Yeah.
I don't want to live this way for 7 days. What are my options?"
And then as a healthcare professional, the easiest thing, honestly, is just if you say what you want.
Okay.
If you want the referral for gynecology, say, I want the referral for gynecology.
Okay.
If you kind of dance around the issue, like we as healthcare professionals go in to help people and we want to make you happy
Right.
with your experience,
Right.
but we can't read minds.
That's right.
And we all have different communication styles and different backgrounds. So just tell. Just
Yeah.
tell us what you're looking for, what you
Ask
want,
for what you
or what
want,
you're
people.
worried about. That's the
Right.
other thing. If you're worried like these periods are worse, is it cancer? Ask.
Right.
Say those words. Is it cancer?
Right.
Because otherwise, that wouldn't even cross my mind
Right.
that you were worried about that.
Right.
So if you're worried about it and it doesn't come up, bring it up.
Yeah, because you can't help someone or calm someone down or
If you don't know what
reassure
they're up-
someone
if
if
you
you
don't
don't
know
know
what
what
you're
that
worried about.
panic is rooted in.
Yeah.
Right.
And we can't offer you options if we don't know what you're looking for.
Right.
Because some people, again, it's all subjective. Some people would say like, oh, I change a pad every hour, but it's totally manageable. But if you just say I'm changing a pad every hour, I might be like, oh my God, we got to do something. And that's not what you want. You don't care.
Right.
And then another person would be changing a pad every 6 hours and they're like, I hate this. I can't deal with this. And I wouldn't know that. So you have to say what,
Right.
and you don't need to know specifically like, I want this, but just say like, I don't want to live like this anymore.
Right.
I want something dealt with.
Yeah. Even
Ask.
I want to know my options.
Yes,
Like
just,
what's out there.
but just try to ask and as specific as you can, especially if you've got concerns.
Okay.
Because everybody is worried about cancer or they have a friend who had some rare or unusual thing. We all have those stories and
Yeah.
it's in the back of our mind.
Yeah.
But it might be the symptom that you're worried about might have nothing to do with that.
Right.
So your healthcare professional doesn't even think that you're worried about the cancer or the rare disease because they're like, that's completely unrelated.
Right.
So, and we don't think about that. So just say that word. The words are scary, but you'll feel better when you do.
Definitely.
That's such good advice.
It is.
Yeah.
I'm glad
And it's so simple.
It is.
Are you glad that I broke the rules?
Yeah. So we have. Are you ready for the next segment?
there's
of
so
the
many other
episode?
things I wanna
know,
ask.
But we're
Okay.
gonna have we're gonna do
Jillian, segments with Jillian. I love
segment.
it. Jillian, this has been incredible. It's been so just educating and fun, and I feel so much more comfortable to like
Me
advocate
too.
for my own health now. So just in these few short minutes, and I know our listeners will too. And we're so excited because you have agreed to come back on the pod.
Yes.
Yay! So we can talk more. And I think it's good to maybe we'll focus our conversation around some themes, around some things, so we can really get into the nitty gritty of some certain topics. Because gynecology, obstetrics covers so much. What you do.
So much. It's such a huge field, and we are subdivided into subspecialties. And people are going to have different questions related to the different stages of their life. So I think if we focus, we can hopefully get to everybody's questions and make people feel a bit more empowered, a bit more comfortable. In
Amazing.
all aspects.
I love it.
Because I want to know more about like just vagina health or vulvar health.
Yeah,
in
now that we
general.
know, yeah.
Like just in general, like, okay,
Vulvar hygiene.
am I using the Vagisil?
No, you're throwing it away.
You heard it here first.
Okay, but what? Okay, but I want to know why right now.
Well, do we...
6 week follow up.
6
6
week
week follow up.
6 week follow-up.
Okay.
So
Sounds
we'll
good.
meet back with Jill. We'll ask all our questions then. Maybe the first topic we'll do is vulvar hygiene. Vulvar hygiene. We'll talk about the importance of, is it like a self-cleaning oven? Like does your vagina?
These are the things we want to know.
So throw out the Vagisil between
Stop
now.
things up there to clean it.
Okay.
It will do it.
Okay.
The next 6 weeks, your vagina has you covered.
okay.
So
sounds
don't do anything for the next 6 weeks to that vagina. And
You
Jill
heard it,
will tell
Daniel.
us-
She said not to put anything up there.
You got to pass for the 6 week. Jessica's like, yes. You heard it here first. But in terms of your hygiene, also don't go be buying your summer's eve or whatever it is. You don't need it. And we'll talk more about why you don't need it on our next pod with Jill, our follow-up appointment.
can't wait.
Or ask her OBGYN. Sound good?
Love it.
Amazing. Is there anything that you want to cover in this episode before we move on to our morning meeting questions that we ask all of our guests? Anything you want the listeners to know for now?
There's so much. There's so much to talk about. So there's nothing specific, and at the same thing, like a million things that are jumping into my head. But really, like, don't be afraid to be your own advocate. But if you're being your own advocate, the best way to do that is to be specific about what you're looking for, about what you want. We do want to help you. Physicians really do. But you can help us help you by being as specific as you can.
Right.
Awesome.
Love that.
Love it.
Yeah, me too. Okay, let's jump into our morning meeting questions. We'll come back in a follow-up appointment. We'll talk about vulvar hygiene. And then maybe we'll even move into like contraception options
Reproductive
and
health.
reproductive health.
Family planning.
Yeah, so much.
Awesome.
Hormones.
There's so
What's,
much to talk
yeah,
about.
there
There
is.
is.
Yeah.
And just off the top of your head, Jill, the your practice right now, so you do OB, you do gynecology. It's the split. Is there, if you had to round it percentage-wise?
Thinking it's 30% OB, 70% gynecology. Off the top of my head, I think with different people in different parts of the world, that's going to be different, and even just based on personal preference, people are going
Right.
to have
Right.
different distributions
Yeah.
of that. But that
Yeah.
would be my practice at this current moment.
Right, in this location where you are, all those
Exactly.
factors play into that. Yeah. Wow, so interesting. Wow, your day-to-day just must be
Yeah.
so interesting. All right, let's get into it, Jess. You want to hit her with
Yeah.
the first question?
Here's your tough questions.
Okay.
Everything else rolled right off the top.
yeah,
Right?
exactly.
Yeah.
Nervous for this.
Right?
No, you'll do
Right.
great.
The pressure is.
Yeah, talk to me about all the medical jargon, but let's talk
Right.
about you. And you're like,
Yeah.
no, wait.
Yeah.
No.
Okay, so what advice do you have for your future self?
It's so trite, but honestly, stop obsessing and worrying about the things that you can't control. I have lost, I think, years of my life worrying about things that were completely out of my control, that had nothing to do with anything. Like the amount of sleep and the tears that I shed over things like, which program am I going to match to? Am I going to match? Am I going to pass the Royal College after it was done? You have no control. Stop worrying about it.
Right. Yeah.
And even if you do screw up, even if you fail a test or you don't get that job, like, you would survive. You will not die.
Right.
It's
You
not
won't literally
perspective.
die.
Perspective.
What a good perspective. Because in
Yeah.
that moment, you feel like
You
that is
feel
it.
it.
That's the
Yeah.
end.
That
If
you'll
you
just drop dead.
right. If
But
you,
you won't.
and if you don't pass that test, you're never going to pass another test. That's
Exactly.
not the case.
Exactly. And, you know, it's good perspective in hindsight, but
Right.
I sure didn't have it at
Of
the
course.
time
Yeah.
when I was
Of
crying in a
course.
hotel room.
Right.
Watching like Eddie the Eagle
Yeah.
with a bottle of wine. So I don't have that in the moment. It only sounds good now that I'm out and past it. But yeah, there's things that you can't control, and it's easy to say, but you're just going to lose energy and cause yourself undue stress
Yeah.
for things that you can't control.
That's
I'm
right.
going to take that and run
Control
with
the controllables.
that one. Yeah, that's your
Control
motto.
the controllables. How do you define success?
Oh, that is a huge and deep question, Sarah.
It is. Well, to me, you're like the epitome of success.
Oh,
so it's
I
so
would-
interesting
I don't feel
to
that way,
know
but-
how you would define that.
And that has been a changing target over my life. Certainly when I was younger, it was, you wanted to win the awards and be the best.
Right.
And I've talked a lot about this with one of my friends who I went to residency with. And we've talked about how that changed, where you wanted to be the best surgeon who did the biggest, baddest ass cases to honestly, success is doing the best you can with the skills that you have for the patients in front of you.
Right.
And on a personal level, I think to say happiness would be, I don't think you can be happy all the time. That's not life.
Yeah.
But I think general
Yes.
contentness and safety.
Definitely.
Safety.
Yeah, to feel safe financially,
Yes.
physically, mentally. And just to be content and to be able to ride those waves, because there are going to be good times and bad times, and not to let the bad times derail your overall wellness totally.
Right.
Yeah.
That is
great.
such a great answer.
Okay, what do you wish you knew then that you know now? So could be years ago, could be yesterday, a minute ago.
I wish again, this kind of ties into that advice for future self. I wish I had known that it would work out.
Right.
Because especially at those peak transitional moments where you're waiting to see if you match to the residency you want, if you pass your exam, if you get into medical school, like you really don't feel like it will work out.
Right.
So to know that it will work out, you might not get into the school of your choice. You might have to apply again for residency. It might not match. You might have to take a test twice, but it's going to work out.
Right. Work out. So true.
And the other thing I guess would be like what you think things are going to look like as working out might not be what
Right.
like what we thought as our lives would be
Yes.
when we were kids. What we thought we needed to be happy or content is totally different. And that's okay.
Yes.
That is okay that the goalpost changes. And don't feel pressure about that. Like your goalpost just changed.
Yeah.
Your values and your circumstances changed, and that's okay.
So what is something you've learned during the pandemic?
Oh God. I mean,
Starting a business, like opening a practice.
medically and professionally, there were 8,000 things. But I think for a lot of us, the pandemic just clarified what really is important. And I think I was surprised at how well I did with just family
Yeah.
and adapting and doing Zoom or whatever with friends. But it really did narrow your circle and make you appreciate the people a lot more. And you also learned how to adapt in socially. Like, that is not something that you really would have thought that you had to adapt to.
No, that's true.
So you've learned, like, how are we going to all watch this movie together or do a crafting night together? Because that's what a lot of friends and I like to do. Like, how are we going to craft together when we can't go to each other's houses?
Right.
So figuring that out has been a learning curve, and it's been challenging, but it's been fun.
Yeah. We all made it. There's your will, there's your way.
I guess I learned that I'm a hermit. Like, I can do really well staying at home.
Yeah.
Yeah.
Well, that was our joke through the pandemic is like, you know what? My day to day really hasn't changed
Are
that
we
much.
actually
Like, I'm kind of in isolation anyway, but I'm going to complain about the fact that I'm not allowed to go somewhere if I wanted to go, even though I would choose not to, right?
Exactly.
Yeah,
So
the-
fun.
yeah, that's
Now
the
that you can
difference.
go to the grocery store, you're complaining about it.
Yes.
And you couldn't, it was like, oh my God.
Yes,
have to
I
order
wanted to
online.
decide. Yeah,
I want to
exactly.
pick my produce.
Exactly. So, Jillian, just finish this sentence for us, and it can be a thought about the future, something about the past, present day. It can be deep or surface or as funny or as serious as you want to be. So just finish the sentence. What's something you're wondering? I wonder.
Okay, so this is Wonder Lately.
Okay.
And it's only because I listened to a podcast about it recently.
Okay.
Or, no, sorry, not a podcast. I watched a Netflix show. Okay. Have you guys watched The Staircase?
No.
On Netflix? Do it. Do you like true crime?
I do, but I'll have nightmares. Yeah.
Okay. Anyway, for anybody who's watched it, all I've been wondering is what really happened.
Now I need to watch it.
Because I've watched it a few times now, and every time my mind changes, and it kills me because I am a pretty like opinionated set. Like I can watch it and have an opinion,
Right.
and I keep flip flopping, and I need to know the reality, and I know I'm never gonna know what exactly happened, and it kills me.
Other people's perspective.
We will. We'll have to throw a
It
poll up and see
kills
what
me.
people think happened.
I
So
have
tell
literally-
us, give us some context. Is it a true story? Is it not a true story?
It's true
Is it-
crime.
Okay.
It is a documentary
Okay.
that is basically filmed in real time, basically almost right after this either natural death or murder happened.
Okay.
Because they did get access starting right through. So you see the whole process of the trial.
Okay.
So it's from one perspective, and you even see it like years later when they do the appeal process. So it's basically, the long story short is, did this guy kill his wife or not?
Okay.
And I keep flip-flopping. I keep flip-flopping, and it drives me crazy.
I want to know. Yeah.
It drives me crazy that I don't know. But any of those true crime mysteries like Zodiac or D.B. Cooper, that kills me that I'm never going to know.
I know.
I hate that. I want to know. Like, I truly hope that people are right. Like, when you die, all those questions are answered before you go. Like, I need to know.
Yeah. Those would be all
I
the
need
questions
to
that
know
answer
the
for you.
Dilatov Pass and all that stuff. Like, I need to know.
That is hilarious.
That's the completion complex we talked about before. It's like it's not complete unless I know how it ends.
There's nothing I hate more than at the end of like a documentary or Unsolved Mysteries where they're like, we may never know.
They should say that at the very start so you can decide if you want to continue or not.
Like, skip.
Yeah.
We know the answer to this one.
Yeah.
Tea or coffee?
Coffee.
Obviously.
Do you ever drink tea?
Yes. Okay. So there is a difference here. Like, I love coffee and I do drink it because I enjoy it.
Right.
But for me, tea is something that's leisurely. Like, you're sitting and you're drinking with friends, or you have a book and you have time, but it's not something that I would associate with like my day-to-day get up and go.
Yes.
That's coffee.
Okay. That makes sense.
Yeah.
Yep. For wine, white or red?
Sparkling.
Ooh.
I love bubbly.
Okay.
But actually, probably red, except that again, it's really seasonal. Like summer and spring, white. Fall and winter, red.
Makes sense. Moody.
Yeah,
It's
it
moody.
does.
It does. With it's warming and white is cooling. Like, you never feel like a red when it's 30 degrees out.
That's so true. Sometimes I put my red in the fridge though, so that I can have it in the.
See, I can't. I can't drink cold red, but like my white, I want cold. So it's different seasons.
That's true.
That makes sense.
Would you rather be stuck on a broken ski lift or a broken elevator?
Oh my God, those are terrifying. Those are absolutely terrifying options. Okay, I'm afraid of heights.
Oh no.
But then, even though you couldn't see the heights, you could drop from the elevator.
That's true.
I feel like if you're on a ski lift and you jump down, there's going to be snow, so you might like break some things, but you'll live.
Yeah.
But if you're really high and that elevator drops, you are dead. And we've all seen some sort of horror movie that involved that scenario, so I've got to say I prefer the ski lift.
Yeah. Jessica?
Well, my first thought, I always say neither, but I know that's not an option, but
It's right in this case.
Yeah, neither.
I'm terrified of ski lifts. I'm
you?
terrified because I feel like you're not secure enough in them at all.
Right.
It's unbelievable. I feel like you could slide out at any moment.
No, I want a seatbelt.
But then the thing about the ski lift is at least you can see.
Yes.
Yeah.
You can see how far up you are.
Yeah.
I
You
don't
can
know.
gauge if you should jump.
Yeah.
But fluffy snow that high up is not fluffy snow. It's hard packed snow. Like, we're breaking some limbs. We're breaking.
Yeah. Oh, yeah, you're breaking things. But you might not be dying.
For
I've been
me,
smushed to death.
yeah, when I read like stuck in an elevator, like my chest got tight, so I know that I don't want to do that. But I'm claustrophobic, so like
So,
the
yeah,
walls
that's
would close
another
in on me.
yeah.
I think, but I skied this past winter for the first time in years, and I loved it. But skiing scares me. Like skiing, you can be so out of
What
control.
about on the lift itself?
But on the lift, I like you're outside and you're like, oh, pretty
But then
sights
you
and
feel like
whatever.
you're gonna slide
But
out
then it's that moment when the ski lift stops and
And
you're
it
in the
jerks.
middle and it jerks back and forth and you're like, I'm gonna die. So I wouldn't
Yes.
love to be stuck up there either. So that's a really hard one. But I think I have to go with this. I would
I think
rather the ski
we're
lift.
we're in unison. This has been great.
Oh, it's
This
been so
has been
great.
so much fun. I really enjoyed this.
I'm looking forward to the
glad.
6-week follow-up.
Yes. Can't
follow-up
miss. You
appointment.
can't miss your follow-up appointments.
Nope.
They're very important.
We're booking it.
We're booking it. We are so grateful for your time. We know how valuable it is. So thank you for scheduling us in. We cannot wait to see you again. We know our listeners will just have enjoyed this episode so much and learned so much. We've learned so much, and that they'll be so excited to continue learning with you and from you. So
great.
yeah, I can't wait. So
Excited, let's go on this journey.
yes,
Talk about vaginas.
let's talk about them. Vaginas
Let's
and
say on
vulvas.
3. 1, 2, 3.
Vaginas! I love it. And we have to get used to saying vulva.
It
Vulva.
does not have that same ring.
No, it doesn't.
Vaginas, 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 vagina, vagina, vaginas, vaginas.
That's our new outro
I will
music.
follow me.
Thank you so much, Jill.
Thank you guys for having me.
If you enjoyed today's episode, please subscribe to our podcast and give us a review. You can find us on social media at The Morning Meeting Podcast and connect with us through email at themorningmeetingpodcast@gmail.com. Thank you for sitting around our table. Sarah and Jess.